I think Experian has helped us a lot in making registration processes more streamlined and easier to teach. Before Experian, we had a lot of different systems. Our staff were required to sign in to upwards of 12 healthcare systems to do their registration, which makes training very difficult and learning very difficult. So with our Experian products and our eCare Next, being able to do a single sign-on, having their tools fully integrated into our healthcare system, definitely made it easier, shortened the registration process. We were able to build e-learnings that really worked with our EHR system and did not require our staff to have to work out of multiple systems. So having all of that information at their fingertips was definitely a huge plus. Yeah, our metrics are very key for everything that we do. So Experian allows us to use something called power reporting. So every single tool that we have, from registration accuracy, which is probably one of our #1 key metrics, is how accurate is our registration. So we're able to monitor the number of registrations staff are doing, how many errors they're making, how quickly they're resolving them, and tie that to a lagging indicator for initial denials. So really being able to try to see the entire flow and see where something may be broke, where we may need to make additional adjustments in our alerts. It also ties into one of our main KPIs, which is cash collections. Cash is king in healthcare, especially in revenue cycle. So we use our estimator and do 100% estimates for every patient that walks in our door. So we know how much we should be collecting, and then we see how much of that did we collect. So those are 3 major KPIs that Experian helps us track. We use pretty much the full suite of front-end patient access products with Experian, and each one of them is able to be reported on within their Power Report module. So it creates a dashboard for us every month so we can track by facility, by department, by staff member, exactly where they're at with each one of those primary tools. So it really allows us to drill down and be able to coach and educate staff who are struggling, create action plans for facilities that are not meeting their goal, and reward those that are really not just hitting the expectation, but hitting the extraordinary marks. Experian has been a wonderful partner for Banner Health. I don't look at them as a vendor, I look at them as a department down the hall. They have always come to the table to help us determine how to do business better, sharing best practices. I think one of the areas that I've appreciated most about Experian is their willingness to collaborate. Very seldomly do we take the product out of the box and implement it. We always want to make a tweak to it. We want it to do something it wasn't necessarily designed at the front to do. It has to integrate with another system that Experian may have that product, but we are not using it. We want them to partner with another vendor, and so that it's a more streamlined process for our staff. And I have found that they have been extremely open to doing that.